Hi, my name's Caitlin, and I'll be your student nurse today. I have MAR record B, and I'll be giving a subcutaneous injection. Before I begin, I'm going to make sure that I use proper standard precautions, proper privacy, safety, body mechanics, and hand hygiene. Before I do my first check, I'm going to make sure that I have the correct client, which is Jane Doe. Her birth date is 1/23/27, and I'm going to do hand hygiene. So since I did that, I'm going to get started on my first check. My check would be to look at my MAR and look at my med dispensing system. I need to have NPH insulin, and I have NPH insulin. And when I do my first check, I need to make sure that I have the correct client, which is Jane Doe. Her two identifiers, which would be her name and date of birth, and her date of birth is 1/23/27. I need to make sure that I have the right medication, which is NPH. The right dose is going to be 10 units. The route, I'm going to inject in her upper arm in the subcutaneous layer. The right time, I'm going to have to give this at 0800. And I'm going to need to make sure that my client doesn't have any allergies, and she has no known allergies. So once I've done my first check, I'm going to move on and I'm going to select my syringe. So I selected the U100 insulin syringe because I only need 10 units and it's going to be easy to see where I have to draw up 10 units out on this. So I am going to do my second check, which would be me drawing up this medication. Once again, I still have to make sure that I have the correct client, which is Jane Doe. Her right medication, and her birth date, which is 1/23/27. Make sure that I have the right medication, which is NPH. The dose is going to be 10 units. The route, I'm still going to go for her upper arm. The time I have to give this is at 0800, and I need to make sure that she doesn't have any allergies, and she doesn't have any known allergies. So I'm going to open this up. I have my syringe out. Before I uncap that and everything, I'm just going to roll this in my hands just to make sure that everything is mixed properly. Once I've done that, I'm going to scrub the hub for 15 seconds with an alcohol pad. Okay. So since I've done that, I'm going to uncap my syringe. Stand it straight up. I need 10 units, so I'm going to pull back 10 units of air. I have 10 units of air. I'm going to place this into my vial. I'm going to inject the 10 units of air. And then I'm going to draw, hold on. Going to need to draw 10 units of insulin. Making sure that there's no air bubbles. I'm going to recap this because I have to give this to my patient at the bedside. So I'm going to recap that. And then I'm going to do my third check at the bedside. I'm going to make sure that I have the correct patient, her correct birthday, the right medication, which is the NPH, the right dose, which would be the 10 units, the right route. I'm going to position my client so I can access her upper arm to give this. I'm going to make sure that the time is correct. I'm giving this medication at 0800, and that's what it tells me to give it at. Making sure that she doesn't have any allergies. And before I did all that, I made sure that the expiration date, that this wasn't expired, and the expiration date is 07/2024. So I'm going to do, since I did my third check at the bedside, I'm going to put my gloves on. I have my client positioned so I can access her upper arm. I'm going to use alcohol pad, and I'm going to wipe her skin to make sure the area is clean. Okay. I'm going to uncap my syringe. I'm going to pinch an inch, and I'm going to go straight down at a 90-degree angle into the client's upper arm. I'm going to inject the insulin and pull out. And then I'm going to push this up so I can put it in my sharps container. Once I've done that, I'm going to use a gauze pad, and I'm just going to pat the skin a little bit. Once I did that, I'm going to take my gloves off, dispose of them, and then I'm going to document that I gave Jane Doe NPH insulin 10 units subcutaneously in her upper left arm at 0800.